Okay, we're going to talk about Chapter 15, Newborn Nutrition. There's a chapter in your text, and there's also a chapter supplemental in your ATI. So make sure you look at both of those so you're prepared to kind of talk about those things. Okay, now let me figure out how to make this go. Okay, newborn nutrition. When the baby's inside mom, baby's getting its nutrition through passively. Mom's eating, mom's sending it all to baby through the umbilical cord, through the placenta, and it's passively being transported to the baby. Once the baby's born, it's going to have to try to get its own nutrition by sucking or getting what it needs. Well, newborns are a little bit more unique. They need a little bit more water and calories and certain fats and certain things just to make sure that their growth and development stays like it should. So we're going to be looking at as far as breast milk and formula will have a certain amount of protein, a certain amount of fat, a certain amount of calories, just to make sure that they're getting that growth and development or enough to be able to get that growth and development. Sometimes babies that are less than 6 months can be a little bit more at risk for hyponatremia or the low sodium if we give them just water. So we don't really encourage water intake early on just because of that, because we don't want them to fill up on water and not get the nutrients that they need. Breast milk and formula both are balanced to meet all the fluids, carbohydrates, protein, and fat needs of that newborn. So they don't really need any additional fluids that first 6 months. So we just want to make sure that they're receiving what they need and they're getting their formula and they're getting their breast milk like they should. So talking to moms about how they need to select what's best for them. Well, the types that we give them is either breast milk from the mom or commercially prepared formulas. And there's lots and lots and lots of different formulas that you can choose from. And the way we're going to give it is either by breast or we're going to give it by a bottle. Now, some people will exclusively want to breastfeed. Some people will want to exclusively want to bottle feed. Some moms are breastfeeding moms, but they want to go ahead and supplement with formula sometimes. Sometimes they want to exclusively breastfeed and pump so somebody else can give the bottle. So there's a lot of different kinds of ways to do it. It just depends on what that mom wants and what she decides that she's going to do. But education is going to be very important, just making sure they understand how to do all of that. So trying to decide what method's going to be best for them, it's a very personal choice on what they want to do, but a lot of things need to kind of come into play, like their culture, age. I can tell you very young mothers struggle with it because they don't have a lot of life experience, and sometimes they give up before they get into the habit of breastfeeding. Breastfeeding is very difficult to do. It's painful. There's a lot of things that can go along with it. There's a lot of anxiety that goes along with it. So your young moms struggle with it, and sometimes your older moms struggle with it because they're afraid that the baby's not getting enough milk, that, they're kind of worried about that. As far as socioeconomic status, breast milk's cheaper. It's free. You produce it automatically. Formula is expensive. So there's a lot of kind of things that can go into that. What type of education do they have? Are they educated? Are they, do they know what the good things are, what the benefits are, what the things aren't? Are they just going by what grandma says or, whatever? So, letting them learn those good things on their own. It is hard when you have a young mom because everybody wants to give them input on what to do with their babies. Instead of that young mom taking and researching what is best for my baby, we want to look at that and figure out what is best for my baby. Look at any past experiences that they've had. Have they breastfed before? Was it successful? What kind of support systems do they have? And if they intend to go back to work. If they go back to work, they're definitely going to have a pump unless they choose to stop, if they choose to breastfeed for the 3 months at their home and then bottle feed after that. So there's a lot of options that they can do. Other considerations that we want to take in consideration is give that mom enough education, enough information for her to make an informed decision that she makes, not that anybody else makes for her. Provide her a lot of support. Don't make her feel guilty if whatever choice that she makes. As nurses, we know that breastfeeding is probably the best thing that they can do for their baby. However, if that mom doesn't want to do it, don't make her feel guilty on doing it. It's okay. You know, the baby's still going to get what it needs. There's just a lot of good things that come out of breastfeeding. Don't suggest one or the other for the mom. Give her all of the information materials and let her be the one that decides what she wants to do. If she's going to exclusively breastfeed, that is going to be a commitment, and it's going to take a lot of effort for her to be successful. But she can do that with our support, and if she has a good support system at home. So as far as breastfeeding, it is the recommended method because it is pretty much more superior as far as all of the nutrients that need to be in it, because your body is giving that baby everything that it needs to be successful. It is recommended by many, many different organizations, Leche League, American Academy of Pediatrics, all of the OBGYN magazines, everything recommends that. So we recommend exclusive breastfeeding until 6 months, which means no food, no water, no nothing. And that should continue until at least 12 months. Now, the mom gets to decide after 12 months, you know, do I want to continue or do I want to stop? Totally up to the mom, but they do suggest that they do it for 12 months, and then they will talk to them about that. One of the goals for Healthy People 2030 is to get more people to breastfeed, get more people informed, get more people on board with breastfeeding to help them with that. So as far as advantages and disadvantages of breastfeeding, the maternal advantages that help with the moms, they have less bleeding during that postpartum period, because that oxytocin, when the baby suckles on the breast, it causes that release of that oxytocin, and it clamps their uterus down more. And so they're going to have that involution of that uterus quicker because they're clamping everything down. They do lose weight faster because the mom is trying to feed a newborn, so they're going to lose weight. It does lower the risk for coronary artery disease, breast and ovarian cancers, and hypertension. So to me, that's a pretty big benefit just for the moms. So for babies, it has specific substances in it that is necessary for growth and development. So does your formula, but the breast milk has certain things in it that are better for them for growth and development. It provides them immunological support. So everything that mom gets exposed to, baby gets it. They tend to have less otitis media, or less ear infections, less diarrhea, less lower respiratory infections. So they're going to be at the doctor less. They're going to be less stress for mom. They're going to be more healthy babies. They do feel like it gives them a little bit of protection against SIDS, insulin-dependent diabetes, and allergies. So those are all huge benefits to help with that. Other things, it's economical. It's always available, that you don't have to have storage, you don't have to have cleanup, there's no utensils, there's no dishes. When you're away from home, there's nothing that you need to carry extra as far as supplies, unless you're going to have to pump. The easy use pumps allow moms to express milk, give to the baby later. It reduces healthcare costs because the babies are healthier, so it's going to give you better things like that. Physiological disadvantages. So physiological as far as the body, are there any disadvantages? There are none for mom and baby. The only thing that would be a problem would be their culture, or what they wouldn't want to do. There are a few times when breastfeeding will be contraindicated. If mom has active TB, that's going to be contraindicated because she can pass it to the baby. If mom has active HIV, she can pass that to the baby also. If mom's being treated with chemotherapy, that's going to come through the breast milk. If she has herpetic lesions on the breast. So those are about the only times, or if she's doing illegal drug use or something, that would be about the only time that we would, discourage breastfeeding. Contraindications. There are some contraindications. These are disadvantages. These would be, sorry. It won't let me go back. Let me go back. These are disadvantages. Disadvantages and contraindications are different. Contraindications means that if they do this, it's going to harm them. It's going to hurt them. So galactosemia would be one of them. If the baby's born with galactosemia, phenylketonuria, maybe the baby's too premature to suckle on the mom's breasts, mom would have to pump. Those would be, baby can't breastfeed if it's 30 weeks and they don't have a suck reflex and their respiratory rate's 65. So those are things that we would be contraindication, or they could hurt the baby. Misperceptions, preconceptions, or perceived barriers, things that we would have a barrier to breastfeeding. It does exclude other family members from feeding. However, mom can pump, and other people can still certainly feed that baby. Mom may feel like she can't go back to work because she's breastfeeding, but moms can also pump. It is the law that their employer give them break times to be able to pump, and a place to be able to store that breast milk. So there are laws in place to protect those moms. Maybe she feels like it's too difficult or just uncomfortable. Maybe she just feels weirded out touching her own breasts or having something suck on it. So that may just be, a barrier. She just doesn't like it. Maybe she thinks the baby's going to be too clingy. So all of those things are maybe, misperceptions, or maybe they feel like that's a barrier and they don't want to do it. Either way is fine. So babies are born by their anatomy ready to suck on a breast. It's uniquely shaped. Their mouth is uniquely shaped. Their nose allows for breathing while their mouth is full of milk, so they're going to be nose breathers. The only time that would be a problem is if they get stuffy and they're going to have a hard time eating and drinking at the same time. They do have that rooting and sucking reflex that prepares them for that breastfeeding. So moms, we want to start teaching them about the cues. Start looking for cues that the baby's hungry before the baby actually gets hungry. Chewing on their fists, sucking on something really hard, all of that kind of stuff. So when babies are first born, if they're born early, sometimes they have trouble coordinating sucking, swallowing, and breathing, and sometimes they will choke on that milk. So a baby that's going to be preterm or early, we're going to be watching that very closely and make sure they're not getting any kind of aspiration or anything. So we're going to be watching that, but it's a reflex that these babies know how to do it. But these are for term babies that know how to do it, not our preemie babies, or maybe babies that are sick or something like that. So as far as breast and lactation, it's an organ. Our breasts are an organ. They're designed to provide nourishment to a baby. It's very vascular, very, very rich in lymphatic tissue. It has a big nerve supply. We have 15 to 20 different lobes with alveoli that empty into ducts that lead to each of these little nipples, and they come out in different, so the nipples have like 5 or 6 little spots that it's going to come out of. All of this is based on physical, hormonal, and sensory stimuli. So all of that has to be in place for us to have that lactation. Now, even if you have tiny breasts, you can still breastfeed. Even if you have breast implants, you can still breastfeed. So the only way you couldn't breastfeed would be if you had cancer, you had your breasts removed. There's no lobes there to fill with milk, so you would not be able to do it then, but that would be the only way that would prevent someone from breastfeeding. Physical control of lactation, how do we physically control that? It's kind of controlled by hormonal levels in the brain, but a lot of times when we breastfeed and it's released, the body tells the brain, okay, they sucked this much milk, so our body will produce more milk to take care of that baby. And it will only it'll only replace what was removed. So if the baby takes 3 ounces, they will go 3 ounces. It takes about 6 weeks for all of this to really start happening. So when moms first start to breastfeed, they have tons and tons of milk because the body doesn't know if it's feeding one baby or a litter of babies. So it doesn't really know. So it gives us whole lots of milk. But by about 6 weeks, they're starting to know, okay, well, the baby's really only taking 2 or 3 ounces, and it starts backing off. So you don't keep producing all of that milk. It's just that first 4 to 6 weeks is really rough because there's just a lot happening in there. Make sure that mom has plenty of time to drain those breasts out, because when she's feeding that baby, she wants to make sure she gets those drained out and we don't leave stagnant milk inside there. So we'll talk about how much time a baby needs to be latching. So as far as hormonal control goes, the baby sucks on the breast, the pituitary gland produces prolactin and oxytocin. The prolactin causes the release of breast milk into the breast. Oxytocin causes the smooth muscle around the alveoli in the breast to contract and cause that milk to come out. So that's kind of the hormonal control. As far as sensory, the woman's body kind of responds to the information that it gets from the baby. So when you hold the baby, when you love on that baby, when you visually look at a baby, when you hear a baby cry, when you smell your baby, that is going to produce milk. So all of those things produces milk and causes what we call a letdown reflex. And when moms will breastfeed, they will feel that letdown reflex go into the breast, and then the milk will start to flow. So the milk's not necessarily in there, sitting there waiting. When the baby starts to suckle, you'll feel that letdown, and that's when the milk goes into those things, and it's produced at the same time that the baby needs it. So what is breast milk made of? Well, colostrum is the first milk that the baby gets. It's produced for that first 3 to 5 days after birth. It's kind of thick, kind of whitish, maybe a yellowish kind of color, but it's really, really high in antibodies. So it is really like the best thing for them to get. It's lower in fat, but higher in protein at this point. Now, fore milk is the first milk that the baby's going to get during their nursing session. So colostrum's only going to be there the first 3 to 5 days, and then we don't produce any more colostrum. We will produce fore milk and hind milk. So fore milk is that very first milk when you start to feed the baby. So it's kind of watery, it's kind of thin, it might even have like a little bluish tint to it. And then once the baby sucks for a longer period of time, it's going to be that fore milk will be replaced by hind milk. It's higher in caloric content, and it satisfies the baby longer between feedings. So we want the moms to feed it long enough that they get both the fore milk and the hind milk, so they're satisfied throughout that period that they're eating. So big thing about mom, she's going to have to consume about 300 to 500 calories per day above what her pre-pregnancy needs, depending on her age and other types of things. But anywhere from 300 to 500 calories, she's going to get to increase per day to feed this baby. Now, she's also going to have to carry her Stanley around with her with lots and lots of water, because she's going to have lots and lots of fluids in order to make more fluids for that baby. She needs to continue on her prenatal vitamins and make sure that she's taking all of that so she takes care of her body. So she's going to have to be eating good. So this is not the time to skip meals or, oh, I don't have the baby inside me anymore, I don't have to eat anymore. But you are giving them all of the nutrients that baby needs, so you need to eat good quality foods. So how do we know if the mom's ready to breastfeed? Well, we're going to look at what her breasts look like. Are they cracked? Are they, inverted? Are they too big? There's a lot of things that we can look at to see if they got readiness for breast. If they're not, there's a few techniques we can do. We can teach them how to pull them out if they're inverted. We can use nipple shields. We can do lots of different things to try to help those moms be successful in breastfeeding. We're going to look if she has any past history with her breast. Did the babies, if she breastfed before, did she get really sore? Did she use any creams on them or anything like that? Any lanolin ointment, anything like that? What is her attitude for breastfeeding? Is she excited about it, or she doesn't want to do it? Does she have a support system? And maybe get her a lactation consultant before she goes home. So when you first start that breastfeeding session, one of the big things is we do, as nurses, want to observe their breastfeed, at least 1 or 2 of their breastfeeding sessions, to make sure that the baby's latching like it should. So, that very first session should probably be in the delivery room, and there will be a nurse there to help her doing that. But after that, the baby needs to be fed on demand, which is about every 1.5 hours to 3 hours. On a breastfed baby, they do not need to go any longer than 3 hours. They need to be fed every 1.5 hours to 3 hours. Take their cues. The breast milk's going to be metabolized very, very quickly, so they're going to get hungry a little quicker than they would with a bottle. We will teach them how to wake the baby up, unwrap them, rub their back, flick their feet. Now would be a good time to put them in their face and unwrap them, maybe change their clothes, change their diaper, get them ready for that breastfeeding. Provide them a lot of guidance, support, make sure that they're getting hold of the whole areola, not just the nipple, because that can cause nipple damage. It can also cause like suck blisters. So we want them to make sure they get a hold of that whole areola in there, and make sure that they've got a good latch on that. So there's a lot of positions. This is the football hold. This is the crossbody hold, and this is the sideline position. Those are about the 3 positions that we can do. The moms can actually lean over the babies and let them suck out of the breast like that. Sometimes that is good if they have like some milk stasis in there and they can't get the milk to come out and they've got some swelling in their breast and like, man, it's really painful. Sometimes they can lean over the baby and do that, and sometimes that will help get that loosened up. So when they latch on, you don't just want the nipple, you want the whole areola in their mouth to get on. We're going to look at each of those sessions, and we're going to see how good that baby's latching, how good they're sucking, and how good they're swallowing. Make sure you let moms know that they are going to have an increase in their lochia when they breastfeed, and they will have an increase in cramping, and that's just because of that hormone that's being released from the brain. It's going to cause that increase in that cramping. And when they do that, they might leak from the other breast. So sometimes we can put like a something on the other breast to catch that. There's a Haakaa that you can use, and it can be put on the other breast, and that can help with collecting any of that breast milk that's coming out, and then you can use that to feed the baby later. How do they end that session? Well, a couple different things. The baby needs to suck at least 10 to 20 minutes on each breast. So each breastfeeding session should last a minimum of 20 minutes, 10 minutes on one and 10 minutes on the other one. Now, one of the things that we encourage moms to do sometimes is take a safety pin or write it down or do something, because if mom started on her right and fed the baby on her right for the 10 minutes and then went to the left for 10 minutes, the baby might not empty her completely out on the left because the baby was hungry when it went on the right. So they'd put their safety pin on the left, so the next time they go to feed the baby, they're going to start with the breast that they left off on to make sure they're pulling all of that milk out that gets out and it doesn't create any stasis in there. So, but it needs to last at least 10 to 20 minutes per breast, not one, per breast. Now, when they dislatch the baby, you don't want to pull that baby out. You want to stick your finger in there, in their mouth, and stop that latch. If you pull them off, you will get nipple damage, and it can be really painful. So always stick that finger in there and just kind of break that suction in there. And then you want to make sure you let the nipples dry, allow them to air dry. You can put some lanolin on them to prevent any cracking or bleeding, anything like that, and then burp your baby. So we want to make sure that we at least observe a few of their feedings to make sure they're getting what they need. So how do we know babies get enough fluid intake? Well, there should be a little bit of milk in their mouth after feeding. You should be able to see it. Is the baby happy after it's eaten? Usually the babies will kind of look like they're in like a little milk coma, and they'll just kind of lay there, and you can move them around. They don't even wake up. But by the 3rd day, once the milk starts coming in, one thing that you can tell the parents, if they're changing 6 to 10 wet diapers a day, that baby's getting enough food. If they have 3 bowel movements a day, they are getting plenty of food. So I know a lot of times the moms worry. They're like, I just don't think they're getting enough food. I don't think they're getting enough food. As long as they're having 6 to 10 wet diapers and they're having 3 bowel movements, they're getting it. Breastfed babies typically will have a bowel movement almost with every time that they pee or every time you change a diaper. Breast milk has a natural laxative in it, so you will rarely see a baby that's breastfed be constipated. So that's another kind of benefit of breastfeeding. We want to monitor their weight. So when the baby's first born, we're going to monitor their weight from their birth weight to their discharge weight. It is not uncommon for them to lose about 5 to 10% of their weight. Usually it's because of dehydration. They're not getting enough. Most of the time, these babies will be back at their birth weight by 7 to 14 days. That's why it's really important that you schedule that mom an appointment and make sure she knows that she has an appointment with a pediatrician about 5 to 7 days after the baby's born. Sometimes the doctors, if they're not gaining weight like they want or they have concerns, they will actually even have them come in within 3 days of delivery to make sure that that baby is getting what it needs. Some of the common things that the moms are going to deal with is going to be sore nipples, engorgement, plugged milk ducts, and mastitis. So sore nipples, they just want to make sure they keep them clean and dry. They can use lanolin cream on them. They can actually express some of the breast milk and kind of put that on there, and sometimes that has very good healing properties, and that will help. Engorgement, They just want to make sure that they empty the breast after the feeding. So if you've got a mom and she breastfed for 10 minutes on this side, or maybe the baby went 20 minutes on this side, and then when she went to this side, the baby wouldn't take anything, she might have to pump that off because otherwise she's going to be very, very uncomfortable. Make sure they wear a good fitting bra, not too tight, no underwire, just a good supporting bra to support the breasts. She might even stand in front of a warm shower and let some of the milk just kind of come out. You don't want to pump too much off because you just want to pump enough off to be comfortable. So engorgement can be kind of tough to deal with if they're breastfeeding. If they get engorged and they're not breastfeeding and they're wanting things to dry up, then you don't want to really pump anything off, because the more you pump off, the more the brain says, I need to make more. So, make sure that they wear a really good supporting bra. They might even have to bind themselves. They might have to use cabbage leaves, cold, anything to get those breasts to dry up and be less uncomfortable. If it's engorgement and they're breastfeeding, that's when you want to use the warm, the heat, the pump. Make sure you're pumping all that off. And then clogged milk ducts, that can happen. That's just if they get clogged. We want to encourage them to make sure that they're sucking. We want the baby to suck. The baby will unclog those ducts better than the mom can unclog those ducts. So we want them to get that baby to latch on. And then mastitis is just an infection in one of the clogged milk ducts. And we'll talk more about that. So breastfeeding concerns. So if moms are breastfeeding, it's going to be very common for babies to go through growth spurts. And it seems like, the baby was in a really good routine. They were just breastfeeding every 3 hours, and now they want to feed every 30 minutes. Sometimes that's because they're hitting a growth spurt and their body's requiring more nutrition. So let them know that that is something that can happen. Let them know about La Leche League. There will be a La Leche League in pretty much every place that you go. There will be a chapter. They can also call the hospital to get some information or to help with things. They might need to use, there are some supplements out there that can actually supplement or help with breast milk production. Breastfeeding amenorrhea. A lot of women say, well, I can't get pregnant while I'm breastfeeding. Yes, you can. Most women will not have a period while they're breastfeeding for that first year. After the first year, sometimes they will start getting their periods back, and they're still breastfeeding. Sometimes they even get their periods back within 6 months, but a lot of times, sometimes they don't. They will go that full year and not have anything. You can still become pregnant. Your body can still release eggs, so it's very important that they know that they have to use some form of contraception during that period of time. So, talking about contraceptive, there are non-hormonal ways. So that's going to be like you got permanent, temporary, and hormonal. So permanent ways to prevent any further babies is tubal ligation or a vasectomy for the males. However, if we just want temporary, one is abstinence. The other one is going to be condom, diaphragm, and spermicide. So that's something that we need to make sure we educate them on back in chapter 4. And then hormonal would be a progesterone-only pill. They cannot take regular birth control, so it has to be a progesterone-only pill. Because if not, then that progesterone, the other pills have other types of hormones in them, and you cannot breastfeed with those. So these are progesterone onlys, or like a mini pill. So letting them know about these concerns, let them know about pumping and storing their breast milk. When returning to work and school, how are we going to do that? So just make sure that they've contacted their employer and that they have a place that they can go breastfeed. And they need to they need to pump every 3 hours. So they're going to have to give them breaks to be able to go to pump and store their stuff. Where am I going to store my pump? That's the law. They have to be able to do that. Storing breast milk. Breast milk, I think, is good for 24 or 48 hours in the refrigerator. If they store it in the upright freezer, in just an upright freezer with your refrigerator, it's good for 6 months. If it's in the deep freeze, it's good for 1 year. So that's really important for them to know. It's good for a long time. Okay, switching gears, we're going to start talking about formula feeding. So it's artificial nutrition that the baby gets, and we just tell them they cannot use cow. It causes the babies to have anemia. So we do not use cow's milk. So it's a certain kind of formula that they're going to be giving them. So they're commercially prepared. They come in lots and lots of different brands, lots and lots of alternative things that are going to meet baby specific needs. So a lot of times when the babies are born, they just give them whatever formula that we start with. And if the baby tolerates it, it's great. But sometimes the babies don't tolerate certain formulas, so we have to switch them. Sometimes they don't tolerate that one and we have to go to a soy formula. So there's a lot of different formulas that we can use. So advantages of bottle feeding: if the baby's been adopted, then, you know, those moms are obviously not going to be able to breastfeed, so they're going to give that baby the bottle. Other times that we'd give a bottle would be if breastfeeding is dangerous to the infant, or maybe mom's on chemotherapy, maybe mom found out she had cancer right after the baby and she's taking chemotherapy. Maybe their breast milk dries up and they're not making enough, and that does happen. It's not super common, but it does happen. It does allow other people to be involved in the care of the baby. So it allows dad to get up at night and feed the baby. It allows grandma to feed the baby. All those kinds of things. So it does allow other things. So disadvantages: it is inferior nutrition and it does not give them the immunological properties. So those are the disadvantages. It's not as good as breast milk, and the babies don't have that immunological kind of properties, so they tend to get sicker a little bit quicker. It's harder to digest, so they have a little bit more belly issues. They have a higher correlation with certain diseases. They get otitis media more, or ear infections. They have more allergies. It's expensive, and there's more steps to feed them. You have to figure out where we're going to store it, mixing it, clean up of bottles, nipples, rings, all of that kinds of stuff. So there's 3 basic types: milk-based and soy-based and hypoallergenic. So the main carbohydrate source is going to be your lactose or your corn syrup solids. So protein is the whey casein blend. You don't really need to know all of that stuff. Just the doctor will order a specific formula based on the needs of the baby. And there's 3 different kinds: a milk-based, a soy-based, and if your baby has lots of allergies, it's the next one. Okay, so how do we assist them? A lot of these formulas are going to come different ways. They're going to come ready to feed, so all they have to do is just stick it in their mouth, ready to go. That's what we give them in the hospital. There's no mixing, nothing like that. Always make sure that we've got the correct feeding instructions for what we have. So, in what position does the baby need to be fed in? Baby needs to be fed with the head up, like this. We don't want to feed it with the head down. Never ever prop a bottle. The bottles are never supposed to be propped, and that's something that we see a lot. So we want to make sure that we're educating our moms on doing that. We don't feed them laying down. We feed them sitting up like this, and we never prop our bottles. So make sure that they have the right position. Observe how moms are feeding them and give some cues back if they're having any problems with it. Observe for any type of choking or baby not being able to swallow, not being able to suck right. Kind of gently shake the bottle before you get started. That way you mix all that formula in there. They don't get like an overload of something at the top or the bottom. And make sure that we burp them after feedings. So those are just a few things that we're going to do. Is that it? No. Okay. So other things. Let me see. There we go. Other things, formula fed. Are the babies able to do it? How much are we going to give them? What's their tolerance for the food? What is the mom's comfort level? Sometimes formula will cause them to be a little bit constipated. They might have a little bit of belly problems with some of that, so they might have a little bit more irritability sometimes with those formulas. So just make sure you're aware of all that kind of stuff. Sometimes we'll start feeding them and we kind of realize that every time I feed him this bottle, the baby doesn't, the baby cries or whatever's going on. So just make sure that we're monitoring that, asking mom the right questions, make sure we know what we're doing with mom with that. So the formula has to be prepared certain ways. If it's ready to feed, you just give it to them. And it'll show you it's ready to feed. You don't have to mix anything. You don't have to do anything. However, that is very, very, very expensive. So most people don't do that. So most people are going to get the bottles where you have the scoops. So there's scoops. So there's 2 ounces of water per 1 scoop of formula. Make sure that they know how to do that, because sometimes they will say, well, I won't give them a full scoop because I'm going to conserve my formula. Then the babies are not getting the nutritional needs that they need per ounce of formula. So we want to advise them they cannot do that. They have to make sure they're mixing it according to those directions on the bottle. Now, they can prepare extra bottles enough for 24 hours, and they can refrigerate. So if you got to work the next day, so that night at 8 p.m. you want to prepare all the bottles for all the way to 8 p.m. the next night, that's okay. They are good once they're refrigerated. So once the baby starts sucking on that bottle, though, that bottle's only good for 1 hour, because baby's saliva is going to get in there and it's going to grow bacteria. So once the baby sucks on it, the bottle's good 1 hour. After that, you need to throw it away. And a lot of parents don't want to do that because it's like, they didn't take anything. I don't want to waste it. I'm going to put it back in the refrigerator. They can't, no. If they have sucked on it and it is set out for, anything for long, or even in the refrigerator for longer than an hour, it has to be discarded. So, and warming a bottle. We tell the parents never, ever, 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 ever warm a bottle in the microwave, whether it's breast milk or bottle or formula. It's never warmed up in the microwave. Breast milk, if it's warmed up in the microwave, it actually destroys the immunological properties in it, so we tell them never to do that. If we do it in bottles, you get hot spots and you can actually scald the babies and cause blisters, so we don't do that. We take either like a bottle warmer, they're commercially bought, or what I always did with mine, I just heated hot water out of the tap, just tap hot water. No boiling water, just tap hot water out of the tap. Take a bottle or a bowl, stick the milk down in that bowl for, 5 to 10 minutes before you're going to feed them, and it gets plenty warm. So that's how you're going to warm your bottles. And then you're going to throw everything else away. You want to make sure you clean all of the parts in warm or hot soapy water. Make sure we're getting everything cleaned out and then lay it out to dry. So don't give your babies any supplements unless you've been directed by a physician to do so. So just make sure you're doing all that. As far as breast care, I think we've talked about breast care already and what we're doing with that. Common problems with formula-fed babies. Sometimes they don't want to eat, and so we have to really work with them. Some babies don't tolerate the formula. They'll start throwing up, they'll get diarrhea, and we do have to be really cautious with that because they can get dehydrated very, very quickly. So you'd want to look at that fontanelle at the front. Is it sunken in? Does it look like it's, sunken in? Dental caries. That's why we say discard the bottles. The babies, you'll see babies carrying around bottles full of juice, milk or whatever. That causes what we call baby bottle syndrome or bottle mouth caries. And so they just rot, those teeth rot. So we need to make sure we tell them that they do not need that bottle all the time. When they're done eating, the bottle goes away. If they want to suck on something, they get a pacifier. And that's how you kind of handle some of that kind of stuff. Don't ever put them to bed with a bottle. So these are kind of amounts. This is just kind of an indicator. So when we first start feeding our babies babies come out and we're giving them formula, we're probably going to start out with just 2 ounces. That baby's belly is probably the size of a pea. It's not going to need much. So it doesn't need much formula. So we're going to start out with and if it takes 1 ounce, that's great. Even if it takes a half an ounce, that's okay for those very first feedings. That's enough to get their blood sugar up and give them some protein and some calories. So that's good. Now, by the time baby starts to get 6 months, that's when they're going to start adding things. But this is kind of our maximums per day. So the baby should really be taking a maximum of 24 ounces per day. You're not really going to know that if they're breastfeeding, so we're just going to breastfed moms, we just assume everything is going like it should, as long as they got 6 to 10 wet diapers a day when they're first born. Okay, that is it. Okay.